Suzanne Yee joins us today to talk about a new advancement in breast augmentation. It's called the Keller funnel, and she's always here to tell us about new advancements, which are coming all the time, right?
They are. Cosmetic procedures are so popular now. Everybody's trying to feel good and look good, and so there's always something new coming out. It seems like almost every week.
Yeah, a new way to make it maybe less invasive and a better recovery, perhaps.
Right, less trauma.
First of all, breast augmentation is still one of the most popular forms of surgery, right?
It is. It's probably the second most popular cosmetic surgery we do. When I first came out, when we were doing breast augmentation, there was still a moratorium on the silicone implants.
Right.
And so I trained with the saline implants. And so with the saline implants, they came deflated.
Right.
And we would just roll them up, and we'd put them through a small incision, probably about this big.
Okay.
And then we would just blow it up with the saline, or fill it up with the saline, and then pull this tube off. And so we were able to use a small incision, less trauma to the tissues. And then in 2006, the silicone implants had the moratorium raised by the FDA.
They came back.
And so they're
pre-filled.
safe. It's safe. It's much better. It has a much thicker capsule, less chance of capsule contracture, and also it's a solid gel. But it was harder to get through that
You can't
small
roll it up
incision.
like you just did that
Exactly. And most patients still want that smaller incision. I still like the smaller incision.
Right, less scarring.
Less scarring. And when we were putting it through that incision, you're having to push it through and squeeze the implant. There's trauma to the tissues and the skin. And so a surgeon came up with an ingenious idea.
The Keller funnel.
Yes, yes. And it looks much like a pastry shell. We almost use it like a pastry funnel. And so basically, we place the implant through the funnel, and we could put the funnel through the small incision, and then we just drop the implant in, and then we squeeze it through. And it doesn't distort the breast tissue or the incision. We don't have to use a larger incision. It doesn't distort the implant, and there's less contamination because we're not handling the implant as much. So it makes it much easier.
You're going to show us how this, or I'm your assistant
You're
today.
You're going to be my assistant
Pretend we're
today.
in the surgery operating room, right?
So basically, we open our implant. It's in this little plastic container, and we pour a saline in it. We still haven't touched it. And then my assistant will just pour it into here.
So this is going into the incision, and I just pour, hopefully without spilling this, or I don't want to get, I've spilled a little bit, sorry. But I know the implant is what we really want. Okay.
Sorry.
I did make a mess, I'm sorry. I would be so tired.
My fault too.
Okay.
And then we place this little part into the incision. And we just push it through. Like that. And so it goes through the incision into place without any straining, any disturbance to the tissue, without stretching the skin, without touching the implant.
Why didn't we think of that?
I know. I wish I thought of that.
Yeah, you should have, exactly. So there's less trauma then to the tissue that way.
Less trauma to the tissue, less trauma to the implant, less contamination to the implant.
I think we've got some graphics to put on the screen sort of about the benefits of the Keller funnel. And you mentioned it minimizes the incision.
Right, we have a minimal incision. It decreases the bruising and post-op pain because we're not stretching the tissues as much. And we have less force used during the surgery, so less trauma to the implant. And it decreases theoretically decreases the risk of infection because we're not touching the implant as much.
Now, what is the usual recovery time from a breast augmentation?
Well, typically I do a rapid recovery breast augmentation. So that afternoon we start our patients on exercises like physical therapy. And we place them on an anti-inflammatory, and by the next day they're pretty much moving around doing what they want. I typically don't tell patients to drive the next day because they've had anesthesia the day before. I like them to be off of it for 24 hours. But they can go back to work in a couple of days, and in 2 weeks they can go back to the normal exercise activity.
It is amazing. Does anyone do the old style anymore, or is it all gone to this?
No, about 80% of our patients, or 85% of our patients, are silicone. They're much more natural. They look more natural, feel more natural. But some patients are still afraid of silicone and they want the saline. And so we still have a few patients that use saline.
And you can give them advice on the pros and cons.
Yes,
of both.
exactly.
So interesting. Here's the information. While you look at that, you wanted to tell them about a special offer where you can kind of put two things together.
Yes, the implant company also offers Botox, and so they're offering 20 units of Botox with silicone breast augmentation.
Okay.
So if you get an augmentation, you get some Botox also, and you can also get 20 units for a friend.
Oh, there you go.
Yeah, so we're passing that off.
Share the wealth a little bit, right?
That's right.
Okay, so remember the Cosmetic and Laser Surgery Center right there on basically Highway 10, the Cantrell Road. There's the phone number, and go to the website, and that way you can actually see before and afters.
Yes.
And get just a lot of details before you ever go in for your consultation. But it's that consultation that'll really make you feel comfortable, I think, with what you're going to do. Thank you, Dr. Yee.
You're
Good
welcome.
to see you
Good
again.
to see you too.
We're going to need a towel over here, though, because I did. Yeah. We made it in with the implant, but not all the water. All right, stay with us.